Hi, I'm Dr. Sanjiv Kandhari from New Delhi. I'm a practicing dermatologist for the last 40 years. Today we are going to talk about chronic urticaria. The prevalence of this disease is around the tune of 0.5 to 1% in the general population. It is much more in females as compared to the males, and earlier it used to be believed that children have lesser of this versus adults, but this trend is now changing. But overall also the trend or the prevalence of this is on the rise. So what constitutes chronic spontaneous urticaria? Hives occurring spontaneously with or without angioedema, lasting more than 6 weeks in duration and going away in 24 hours without any trace. And also there is no known cause of this in most of the cases. It used to be believed that chronic spontaneous urticaria is an allergy, but it is no more an allergy because it is basically an autoimmune disease, with the autoantibodies of IgG type directed against the high affinity receptor of IgE, FCERI. There is also an autoallergy which is IgE mediated against the self-antigens, something like TPO. Somewhere thyroid could be responsible, in some cases infections could be responsible, in some cases diet is responsible. But these cases are not specific, they can be or cannot be present. How do we diagnose this condition? Well, essentially it is based upon history and the clinical signs and symptoms, and we monitor it according to the urticaria activity score, that is the severity. There is also another test called urticaria control test which monitors how it responds to treatment. Diagnostically it's not very difficult, but testing wise very minimal testing is required. We do a complete blood count, an ESR and a CRP essentially. In some cases, if the history suggests, then of course we can do an autologous serum skin testing test, a thyroid test in which we also include the antibodies. Also diet elimination tests can be done. Basophil assays, if possible, can also be done. But these of course are not very essential and depending upon the history of the disease. How do we treat this condition? Well, essentially it is the non-sedating antihistamines which should be our first choice of second generation. We should give these drugs daily, not on an SOS basis. We should also give them according to the laid down criteria or the guidelines, in which updosing is sometimes essential, up to 4 times updosing is sometimes essential. Occasionally, depending upon the severity, one has to resort to giving corticosteroids for a short period. This should obviously be given for a short period to avoid any side effects. We can also give cyclosporin 3 to 5 milligrams per kilogram body weight, and a newer drug biologic called omizolimab with very good favorable results. Counseling is an essential component of this disease, and all this combination tremendously improves the quality of life of a patient. Towards the end, I would only like to say one thing, that urticaria today, our aim is that to treat this disease till the symptoms are completely gone. It is treatable. The non-sedating antihistamines which are now available to us are very safe and very good efficacy. Also, corticosteroids should be given for a shorter period. Cyclosporin and omizolimab have been given with very promising results. There are newer drugs in the offing like igulizumab, which is there, and Seglec8, which offer further promising results. So the future for chronic spontaneous urticaria patients seems very promising. But our fight against this disease must go on, till the disease is there with the patient. Thank you.